All right. Well, thank you all for joining us here today. My name is Kiana Connor, and I serve as the Governor's Secretary of Administration. Before we get started today, I want to welcome a few of my colleagues that I do see in the audience. The Secretary of the Commonwealth, Kelly Thomason. Thank you for joining us. We have Dr. Janice Underwood, Virginia's first Chief Diversity, Equity, and Inclusion Officer, with us as well. And we have quite the esteemed guests standing with us, and the Governor will acknowledge all of those. Again, thank you for joining us. Governor Northam, since taking office, has championed voting rights and expanding access for all Virginians, making sure that they have an opportunity to use their constitutional right to vote. And that will not change in this legislative session. He's going to continue that fight. And to tell you more, the 73rd Governor of Virginia, Ralph Northam.
Thank you. You can stand. I want to update you on what actions that Virginia is taking. In the past week, my team has convened discussions with university presidents, hospital leaders, nursing home representatives, transportation officials, school superintendents, public safety officials, members of the Virginia Congressional Delegation, local elected officials, and the business community. We have taken steps to prepare our schools and our transportation systems, and you'll hear more about that shortly. We have worked with state legislators to make sure the budget they vote on tomorrow includes funding for this situation. We have made plans for how members, state employees can telework and how to ensure they have paid leave if they are affected. The Commonwealth of Virginia employs more than 100,000 people, and I understand the choices that employers are weighing. Our Department of Human Resources Management has asked all agencies to update their telework, emergency operations, and leave policies. We are encouraging private businesses to explore telework and paid time off options as well. We are working with the Bureau of Insurance to determine how Virginia health insurers may relax co-pays and testing costs related to COVID-19. I know some of our health plans have already announced plans to waive those, and I thank them for that. I know you have heard a lot about the ways different states are responding to this situation. Virginia's response is unique to our Commonwealth and to our situation. As a doctor of over 30 years, I know that no two patients and no two cases are the same. And I know that you have to be flexible enough to adapt your approach as the situation warrants. We are planning for every scenario and ensuring that our government agencies, our schools, our hospitals, and our Commonwealth are prepared thoroughly and able to respond quickly. While we have not declared a state of emergency, we are prepared to do so if needed. Everyone should understand a state of emergency declaration is an administrative tool. It allows us to suspend procurement rules, ease regulatory provisions, and take other actions. We are prepared to do that when the time is right and when we need those extra tools. Our Department of Health has been leading the Commonwealth's response to the coronavirus, ensuring monitoring and testing of people who are potentially affected. They have also worked to make sure Virginians have reliable, up-to-date information about the coronavirus. There's a lot of misinformation out there, and we are also hearing troubling reports of stigma against Asian Americans. That is not acceptable. The VDH website is an accurate and updated source of information Virginians can rely on. This is available at vdh.virginia.gov/coronavirus, or you can call 1-877-ASK-VDH3. I will ask Dr. Lillian Peak, our state epidemiologist and commander of the incident management team leading this response, to update you on VDH's activities. Dr. Peak, thank you.
Good morning. As of this morning, 9 people in Virginia have been diagnosed with the novel coronavirus. 2 are associated with the Department of Defense, 1 in Quantico and 1 in Spotsylvania County. 4, a couple in Fairfax and a couple in Virginia Beach, recently returned from Egypt where they took Nile riverboat cruises. 1 adult in Loudoun County is believed to have come in contact with a known confirmed case while attending Christ Church in Georgetown. 2 people returned from traveling in countries with level 3 travel alerts, 1 in Arlington and 1 in the Chickahominy Health District. Several of these patients have had mild illness, and they are all in stable condition at this time. Local health departments across the state are working with doctors to quickly identify people who may have been exposed to someone with COVID-19 so they can be tested. Currently, there are a limited number of tests available, but we have more today than we did yesterday. All but one of our cases was tested at Virginia's state lab, the Division of Consolidated Laboratory Services, since they began testing on February 29th. Our state lab, DCLS, gets the materials they need to run the test from the CDC. CDC is working hard to produce more of those materials and distribute them to state labs. Some private labs are now able to perform testing as well. VDH, DCLS, other public health labs, and private labs are sharing information as we work through this, and we are pursuing every opportunity to meet Virginia's need. The capacity in the private sector is expected to increase each week going forward. It's important to remember that influenza is still widespread in Virginia, so someone without a known risk of being exposed to the novel coronavirus is much more likely to have the flu or another respiratory virus. We are urging people to get their flu shot and doctors to test people who have respiratory symptoms for influenza. Until more tests are available for the novel coronavirus, testing at the state lab is being prioritized for people who have respiratory symptoms and were in contact with a confirmed case, traveled to an area where the virus is widespread, or are in a nursing home. We've had no cases in nursing homes, but those are people who are at particular risk for severe outcomes. We are encouraging others to be tested through private labs. Virginia's local health departments across the state are working with their communities to respond. When we identify a case, we gather information about who may have been exposed so we can work with them to reduce the chance of further spread. We continue to monitor travelers and ask that anyone returning from an area where the virus is widespread monitor themselves for symptoms and follow the CDC and VDH guidance on staying separate from others until 14 days after returning. If you develop fever, cough, or difficulty breathing and traveled to an area where the virus is spreading or had contact with a confirmed case, please call your doctor ahead of going to the office to discuss your symptoms. COVID-19 mainly spreads through close contact with a person who's diagnosed with the virus. When you're sick, it's important to stay home. Cover your coughs and sneezes. Wash your hands and try to avoid touching your face to prevent the spread of germs. Also, continue to clean and disinfect frequently touched surfaces and objects. VDH has a lot of information on our website, www.vdh.virginia.gov, and we do have a call center set up to answer your questions, 877-ASK-VDH3. Thank you.
Thank you, Dr. Peak. VDH has been working closely with our private hospitals, which are our front lines of response. We know that a person who feels sick will either call their own health care provider or they'll go to a hospital. I know our hospitals have been making their own preparations. I welcome Dr. Michael McDermott, President and CEO of Mary Washington Healthcare, to tell you more about how our hospitals are planning and responding to this situation. Dr. McDermott, thank you for being here.
Thank you, Governor. Good morning, everybody. I'm Dr. Mike McDermott. I'm the President and Chief Executive Officer of Mary Washington Healthcare in Fredericksburg. I'm also the Chairman of the Virginia Hospital and Healthcare Association's Board of Directors. I also have the privilege of serving as Chairman of the VHHA COVID-19 Committee and as co-chair of the joint Virginia Department of Health and VHHA COVID-19 Committee. On behalf of VHHA member hospitals and health systems throughout the Commonwealth, I'm pleased to be here today to stand in solidarity with Governor Northam, our partner healthcare providers, and public health, public safety, and professional first responders who are united in working together in the planning and response efforts related to the evolving COVID-19 outbreak. Our message today is that the hospital community is treating this work with the seriousness it deserves to meet the medical treatment needs of Virginia patients and families. While this collaborative work is a significant undertaking, Virginians should know that these planning and preparedness efforts are not isolated to the current COVID-19 situation. The fact of the matter is that Virginia hospitals and our public sector partners have worked together for many years to prepare for a wide range of public health challenges, including natural disasters, man-made incidents, and infectious diseases such as COVID-19. As Governor Northam noted last week, Virginia is rated as a high-performance state in the Trust for America's Health 2020 Ready or Not report. This report is a national ranking of state emergency preparedness readiness. That positive designation is a testament to the shared planning and response efforts and the infrastructure that has been built up over the years by the Commonwealth and its partners, including hospitals. At the hospital level, this work is supported through the Virginia Healthcare Emergency Management Program and the Hospital Preparedness Program in collaboration with our state partners. Through these initiatives, we are monitoring healthcare system capacity in the event of any potential patient surge challenges, tracking equipment and other resource needs, and we are sharing situational awareness updates between state and our members on this unfolding situation. Virginians should know that the VHHA and its members remain in daily dialogue with state officials and other healthcare sector partners through regular conference calls and meetings to ensure our COVID-19 coordinated response strategy is executed efficiently. Awareness updates. To that end, the VHHA has established a committee of hospital personnel around Virginia that is meeting twice a week. This committee is focused on mitigating gaps in care by planning for potential community spread of COVID-19, should that occur in Virginia. This committee is creating recommendations for updated facility access standards if needed, workforce staffing considerations, laboratory testing, and there is a need for greater availability of laboratory testing, guidance for outpatient care settings, alternate care sites, public awareness and education messaging, and more. The goal of this committee and the goal of Virginia hospitals is to promote clear lines of communication between health systems, state agencies, and other partners as we all work together to meet the healthcare needs of our fellow Virginians and to keep healthcare workforce safe while doing so. Thank you very much.
Thank you, Dr. McDermott. We want to be sure that our most vulnerable populations can access the health care they need in this situation, as well as other support. We continue to explore options to ensure that vulnerable Virginians have continued access to critical services and support. Our Director of Medical Assistance Services, Karen Kimsey, will update us on the steps Virginia's Medicaid program is taking to ensure that people can get the services that they need. Dr. Kimsey. Thank you. Welcome.
Good morning. As the director of Virginia's Medicaid agency, my message to you today is this. We are ready and able to do whatever it takes to ensure that our members have access to the health care they need as we work to address the coronavirus. Because of Medicaid expansion, nearly 400,000 newly eligible adults now have health coverage. In total, 1.5 million Virginians have access to critical medical care through our Medicaid program, the most in the history of our Commonwealth. We are extremely aware that there are still Virginians who are eligible for coverage but remain uninsured. The most important thing you can do to protect yourself is to get health coverage for yourself and for your family. I want to appeal to Virginians who are currently uninsured to please check your eligibility at coverva.org and apply for coverage. Medicaid accepts applications year-round, so please take this important step today. I can assure you, all of our Medicaid members and our citizens, that we have a strong healthcare system in place thanks to years of careful planning. All 6 of our Medicaid health plans are open to each of our members across the Commonwealth, and they're working side by side with us to address the coronavirus. We are placing a particular focus on the health and safety of our seniors and individuals who use long-term services and supports because we recognize that this virus can hit this population especially hard. I want to reassure all of our members that we have a great deal of flexibility to respond to new challenges like the coronavirus. Our state and federal leaders are giving us the backing we need to maximize that flexibility, and I thank them for their support. We are evaluating changes in Medicaid policies and procedures, as well as new short-term flexibilities that will make it easier for individuals who are eligible to apply for coverage and to receive prompt access to medical care. We are also looking at policies to ensure that eligible individuals do not inadvertently lose coverage due to paperwork issues. We are examining the tools we have and determining how they can help us increase access to care, including greater use of telehealth services where and when it's appropriate. We are evaluating options for relaxing how we do service authorizations for treatment and policies for increasing flexibility for prescription refills. And finally, we are assessing how we can provide the greatest assistance possible to individuals who receive long-term services and supports, whether they are in a facility or living in their homes. An essential part of achieving that goal is to make sure that we are supporting providers and the caregivers who are entrusted to care for these individuals on a daily basis by ensuring compassion and making sure they receive what they need and they deserve. Although most of our Medicaid members are not required to make co-payments, we'll be evaluating how we can waive these payments to ensure that they are not a barrier to accessing treatment. We are working intensely through internal and external critical incident teams and are in constant contact with our partners, including our health plans, our nursing centers, hospitals, and other key critical providers. Together we have the skills, the capacity, and the commitment to successfully confront the coronavirus, and we stand ready to support our Commonwealth citizens during this critical time. Thank you.
We know that people who are elderly or sick are at a greater risk with this disease, which makes it even more critical that our nursing homes are prepared. We've expanded our testing criteria to ensure that any nursing home resident who shows symptoms is a top priority and gets immediate testing. And we have advised our nursing homes and senior care facilities to update their policies on visitor screening and increased patient monitoring. I know that our nursing homes are taking this very seriously. I'll ask April Payne from the Virginia Healthcare Association to talk about how our nursing homes are working to protect their residents and staff. April?
Good morning. I'm April Payne. I'm the Vice President of Quality Improvement for the Virginia Healthcare Association and the Virginia Center for Assisted Living. I'm a licensed nursing home administrator, a nurse. I've worked in long-term care here in Virginia for nearly 20 years. I want to thank Governor Northam for inviting us to be here today and participate in the briefing. We know that the frail and elderly are the most susceptible population to this virus. Our priority right now is to prevent COVID-19 from entering our facilities, and if it does, to stop the spread. The steps we're taking aren't new, but they are certainly being reviewed. Nursing facilities and assisted living facilities are following their infection procedures, and they are ready and willing to work with state and local officials as needed. They're using known strategies to reduce the spread of respiratory viruses, including preventative actions such as hand washing, the use of alcohol hand gels, and covering their cough with their arm. But we do know that families are concerned about their loved ones in our care, and that's extremely important to us. With the guidance from CMS and our National Association, we're advising our communities to take dramatic action to limit non-essential visitors from their facilities. This will include restricting family visits. It will include outside activity groups being restricted from visiting. But experts believe that this is the most prudent action to take in order to ensure we are protecting the frail and vulnerable population. We need to put our residents' health and well-being at the top priority of what we're doing. We're also working to ensure that employees who are sick, they stay home. We're doing additional screening for visitors that do have to visit. If it's a hospice agency, whatever it may be, we're working to collaborate with those different provider types. Another essential step we're taking is to coordinate with our healthcare partners, such as hospitals, to gather and share information regarding the availability of personal protective equipment. So we're able to get that out in the event that we have an outbreak in a facility. We will be able to help one another. All that to say, we stand ready to work with the administration, public health officials, and other healthcare providers to help protect our residents and our patients. Thank you.
As a physician, I know doctors are on the front lines of every disease, and on behalf of Virginia, I want to thank our providers. I know it is not easy work. Our doctors and health professionals in Virginia are up to date on best practices and precautionary actions as they respond to the coronavirus. Dr. Richard Suits of the Medical Society of Virginia will tell us more. Dr. Suits, welcome. Thank you.
Thank you. Good morning. My name is Dr. Richard Such. I am a physician here in Richmond and the immediate past president of the Medical Society of Virginia. The Medical Society of Virginia represents Virginia physicians, physician assistants, residents, interns, and medical students. The Medical Society of Virginia is working closely with the Virginia Department of Health and other relevant partners within the Commonwealth to ensure that the physician community of Virginia is well informed and has the resources necessary to provide quality care to patients during the developing COVID-19 outbreak. MSV and the Virginia Department of Health will continue to keep the physician community, as well as Virginia communities, educated and informed on efforts to prevent the spread of this disease. Just yesterday, Dr. Peek and the Virginia Department of Health held a webinar for physicians in Virginia. Over 370 healthcare providers watched that webinar live, and the recorded version can be found at msv.org/COVID-19. Physicians and PAs are on the forefront of caring for patients with confirmed or possible infection with coronavirus disease. There is still a lot that we are learning about COVID-19, but we are doing our best to make sure that the physician community is prepared and united in our response. Thank you.
Thank you so much. We appreciate it. Well, Virginians use our transit networks every day, often without a second thought. But in this situation, we have to consider the ramifications on mass transit. on public-facing agencies like the Department of Motor Vehicles and how to ensure we're doing everything that we can to reduce potential spread of any disease. Our Secretary of Transportation, Shannon Valentine, will explain just what steps the Commonwealth is taking. Shannon, thank you.
Good morning. I'm Shannon Valentine. Across the entire transportation sector, we've implemented a coordinated plan to closely monitor developments and make preparations to minimize the potential impacts of COVID-19. From trains to buses, from ferries to our rest areas, from safety service patrols to the Department of Motor Vehicle, from aviation to the Port of Virginia, our efforts are focused on the customers we serve, our workforce, and securing critical supplies. The Department of Rail and Public Transportation is coordinating with Metro, Amtrak, Virginia Rail Express, and transit agencies throughout Virginia, focusing on preventing the potential spread of COVID-19, with agencies cleaning, disinfecting, and delivering messages through websites, emails, and social media. Our communications on health and prevention are based on guidelines provided by the CDC and the Virginia Department of Health. At our airports, all cleaning protocols are in place. Dulles, which is one of 11 airports designated by the federal government to receive flights from China, is working hand in hand with the CDC, in particular with screenings with passengers from both China and Iran in the last 14 days, if there have been any connection there. To date, no one at Dulles has tested positive. As we continue to prepare across the entire transportation sector, all modes have been evaluating potential reductions in workforce, identifying tasks that can be done remotely, evaluating all essential travel, and updating all contingency and response plans. Our top priority is safety. We are united and working to be prepared every day. Thank you.
Appreciate it, Shannon. And finally, I know that across the Commonwealth, parents are concerned about the safety of their children and the schools that they attend. This week, our Superintendent of Public Schools issued guidance for all schools to update their pandemic guidelines, and we are in regular communication with division superintendents as well as university and college presidents. I'll ask Virginia's Superintendent of Public Instruction, Dr. James Lane, to explain more about how our schools are preparing. James, thank you for being here.
Good morning. The Department of Education has been working closely with the Governor's Office, the Department of Health, and other state agencies to ensure our school divisions have the most up-to-date information and resources to be proactive and to respond to concerns about the coronavirus. The health and safety of our students and staff is our top priority. We continue to hear from parents and school leaders about their concerns and understand the fears many parents may have. Since the best decisions about students are made closest to home, many of our efforts are focused on preparing our communities for this situation and equipping our schools for anything they may need to support our students, staff, and families. Thus, regular communication is a focus. Ensuring we have accurate information in the community while protecting our children and staff will continue to be the priority of the Virginia Department of Education. We are providing regular communications by updating our website, hosting webinars and conference calls with school divisions and staff, and disseminating information and guidance via memos and emails. We have dedicated a special page on the VDOE website that houses information, guidance, and resources to support proactive health strategies, guidance on attendance concerns, and communications directly to local school divisions. In February, we began issuing targeted communications to local superintendents, which are also posted on our website. We issued our first memo on February 7th to ensure school divisions were beginning preparations. Second, on February 21st, we began to ensure that school divisions had the latest and most accurate information and to address misinformation. This memo on February 21 also addressed the need for school divisions to focus beyond student physical health in response to misinformation and reports that students and families have faced discrimination or harassment based on ethnicity, race, and national origin. Bullying and discrimination is never tolerated in our public schools. Finally, we communicated these messages directly with schools with the issuance of principal memos on March 3rd. This week, we have issued 2 new memos. One of those memos, in partnership with the Virginia Department of Health, asks school divisions to share details of their daily attendance data directly with the VDH so that we can monitor trends around the state as the number of cases increase in Virginia. In addition, we provided an updated memo developed jointly with the VDH that includes additional resources following the first confirmed case in Virginia earlier this week. In addition to sharing our own guidance, we have also been sharing information directly from the CDC and the VDH. This guidance also includes information related to travel guidance for students and staff in large group gatherings and information on cleaning facilities. To ensure we are prepared around the state, last Friday, we met with the leader of each superintendent's region and worked together to review all of the latest guidance from the CDC and answered any questions they had. Later that afternoon, we held a statewide conference call and invited every superintendent in the Commonwealth and their teams, as well as local VDH staff, to join us to hear a presentation from the state VDH on the latest information. We continued to answer questions that they had and continue to answer questions about attendance regulations and laws. It is important to remember that all decisions related to school closures fall within the purview of local school divisions in collaboration with their local health department. Later today, in addition to answering the questions daily and through the channels already mentioned, we will communicate with superintendents an updated frequently asked questions document to address questions we continue to receive related to student assessments, chronic absenteeism, student attendance, nutrition, and required annual school hours. Ultimately, we want to ensure that we are providing the flexibility necessary to make sure that all decisions are being made in the best interest of public health and the safety of our students and school communities. Our school divisions are taking this event seriously, so we are also preparing our school divisions for the possibility of an extended school closure. In the event that schools close, school divisions have asked many questions about makeup days. The Code of Virginia allows that if students miss more than 6 days, they can make up the first 5 days and then only have to make up 1 day for every 2 days missed if they cannot reach the standard 990 hours. The VDOE remains open to exploring requests from school divisions that propose innovative learning models that can document equitable access to the curriculum, learning materials, teachers, and other school services, as we must ensure continuity of education regardless of the amount of time a school may close. At the same time, we must also ensure that the continuity of education is equitable for all students, especially in divisions that do not have technology resources to implement distance learning, especially for earliest learners, areas where they do not have broadband connectivity, and for students with disabilities. We also want to ensure that students have access to nutrition during extended school closure. So we've applied for a waiver with the USDA to open up new flexibility and hope to issue updates related to school nutrition in the near future. Ultimately, again, school closures are made as decisions by local school divisions in collaboration with their local health department. Having spoken to most of our school division leaders around the state, I believe that our schools are as prepared as possible to address emergency situations and are continuing to update their emergency operation plans based on the latest guidance and research. As stated before, keeping our students, staff, and families safe is our top priority. Thank you.
Well, I want to thank all of you for the updates that you have given. They are very helpful, and for all the work that you and your agencies, our organizations, are doing to keep Virginians safe and healthy. As you can see, this is a team, and we've got a great team. I have confidence that our Commonwealth has made the plans and done the preparations to adapt to this situation as it evolves. Together we can get through this, and we will. Please remember to take basic health precautions. They're the same things you should do every day, and I know you've heard them already, but I'm going to repeat some of them. Wash your hands with soap and water. Cover your mouth and nose when you sneeze. Stay home if you feel sick, and avoid touching your face. And one of the things that I'm doing is to stop shaking hands with people. So please don't be offended. It is up to all of us to step up to help keep ourselves and each other safe. We all as Virginians have a responsibility, and I appreciate everybody taking this seriously. Now we're happy to take questions. Thank you all so much for being here. Laura? Yes, Laura. Actually, Dr. Peak, our epidemiologist. Yes, thank you.
This is something that CDC is investigating now to get more information.
My name is Dr. Norman Oliver. I'm the State Health Commissioner. Just the other day, we put in an order for about $2.7 million worth of protective personal equipment from the national stockpile. And I don't have the timeline on that yet, but we will be receiving that. We also have our own stockpile, so we are doing our best to increase the amount of personal protective equipment for our first responders and medical providers who, as you've heard earlier in this news briefing, will be at great risk in doing the job that they need to do in caring for the people of the Commonwealth. We have a large supply of that equipment here already. We're ordering more because one of the things that we do in emergency preparedness is we plan for worst case scenarios. And so in doing that kind of planning, that means we need a lot more personal protective equipment than we have on hand.
I don't know if I can answer for every single Virginia hospital, but I don't believe many Virginia hospitals have stopped elective procedures at this point. Obviously, as the situation changes and evolves, there could be situations where elective procedures are canceled. I'm Michael McDermott, the chair of the Virginia Hospital and Healthcare Association Board of Directors.
Good morning. I'm Dr. Denise Toney, the Director of the Department of General Services, Division of Consolidated Laboratory Services. Currently, we are actively monitoring our testing and reagent capacity. As of today, we have adequate testing supplies in-house to be able to perform testing for 300 to 400 patients, depending on the number of specimens submitted per patient, and we are anticipating 2 additional kits to arrive today, which will increase our capacity to 500 to 600 patients. We've already placed additional orders for more kits, and as soon as we get the kits in, we are automatically placing the new orders for the maximum that the CDC will allow us to order at one time. So what I can say is that we have not turned anyone away. We are working in close partnership with the Virginia Department of Health, and any testing that is conducted at the state laboratory has gone through review by the Virginia Department of Health and has been approved for them for testing at the state laboratory. And so we have adequate capacity to perform testing for all the cases that they have approved for receipt and testing at the state level. And I'll let Dr. Peak answer the second question.
Yes, so as I shared, we do have some criteria in place to ensure that people who have the most risk of having been exposed and could be cases have priority for the testing. And if somebody does not meet those criteria, we are recommending that the clinicians try to work with the private labs to access testing.
That's a great question, and we have been in contact with our universities and colleges and spring break. Some of them have already had spring break. Spring break starts this weekend for others. And we're asking them to use their discretion and also to work with their local health departments. Every region in Virginia is different, obviously. I mean, a college out in the Southwest is much different from one in Northern Virginia. So we're having those discussions. They are making those determinations by working with us and working with the state health departments locally.
As far as the
So we were just received the test results this morning, so we are actively investigating that, but we do know that the person did have traveled to a country that has a travel-free alert. Chickahominy Health District. That's the Hanover County area.
We have set aside up to $10 million thus far, and obviously we have prided ourselves over the years on putting money into our reserve fund, our rainy day fund, and so if needed, we have the financial capacity that we need. It's a great question. I'm sure they have their clinics that you might want to.
So I don't want to speak on behalf of them, but we have had contact with UVA and VCU, and they are interested in developing tests, is my understanding, and they are pursuing how that they may be capable of doing that. But I would refer you to them for accurate and up-to-date information. So we are encouraging all of the different entities around the state to plan, to look at what they need to do to keep people safe. And so I would refer you to the Department of Corrections, but I do imagine that they are making plans and looking at how to address this.
I think we'll just, use the same policies, and, certainly just like I've said, if someone is sick, not feeling well, I would encourage them to stay home. But other than that, business as usual. Yeah. The answer to that is supportive care. There's no antiviral agent that is available today. Thank you all so much.